Good afternoon, everyone. It's a pleasure to stand here before all of you. Thank you, all of you. Thank you for the organizers for giving me this opportunity to talk to us all. I'm going to be walking us through how to handle intense, painful emotions. And I qualified it like that because there are different techniques to handle different emotions depending on how intense they are. So today we'll be talking about those intense, painful ones, talking about the ones that lead people to want to end their life specifically. So I'll be walking us through, before that, I'd like to acknowledge one of my teachers. This is a founder of the kind of subset of cognitive behavioral therapy called emotional schema therapy. He's the founder of that. He's also the past president of the Academy of Cognitive Behavioral Therapy, where I trained. He's also headed several institutions that promote CBT. Presently, he's the World Confederation of Cognitive and Behavioral Therapy's ambassador, global ambassador. And I've been privileged to attend a few of his seminars. And that's where I picked up these things. So I wanted to share what I've learned with us. So the aim of today's seminar presentation is I want you to leave with an understanding of what emotion is, how complex it is, because if we don't understand it, when we experience it, that not understanding will compound issues where we feel like emotions are supposed to be a certain way, we're not supposed to feel a certain way, they're supposed to last for this long, and then they last for longer, and then we feel like, agitated and have the urge to do something that we may regret. So I'd like us to understand emotions, where they come from, the things that worsen suffering, apart from the thing that caused the emotion in the first place. Our attitudes and lack of understanding can compound issues, and then basically take away how to handle them. So this is quite a very sober topic. I hope we grasp, the sobriety of the mood of the nation. We all know the pulse, we can feel the pulse of our country. The other day there were protests in Mina and Ondo states about people not being able to eat, so this is a serious thing. I'll use this outline. I'd like to talk about why, very briefly. I think we all know why. What emotions are, where they come from, whether they're useful or not, the anatomy of emotions. Let's break them down and see when we say an emotion, what does it really consist of? Then unhelpful ways we handle emotions presently. I'm hoping if we can pick out the unhelpful things we're doing, then it will be easy to know, this is probably how I should handle it, and then I'll conclude. So the essence of this presentation is because of the decline in mental health all around the world. So it's not just an African or Nigerian problem. Triple impact of COVID-19, we're just coming out of it, it's still around, but we're coming out of the worst of it. Climate change concerns, wars, conflicts around the world. In our country, we know what's happening ever since forced subsidy was removed. Difficult and unpleasant emotions are part of everyone's experience. So I tell some people that I wish I could see a therapist. I came in here and I wish I could sit and listen to this presentation and have someone else give it, because it's everyone's business at this point. If it's not you, it might be someone you know and love. And the reason for this presentation is that these emotions, they guide our behavior. They urge us to do something. A lot of us, we don't know where they come from. Some people, we don't know what to do with them, and they are begging for action. So that's the reason for this presentation. So some statistics. So 1 in every 8 people live with a mental health disorder. 1 in every 4 Nigerians has a mental illness. This is WHO recent statistics as of 2023. And just, even without these statistics, we can tell that, from experience, that the number of people who are struggling is increasing, mostly sadness and fear. I pulled up this study. There's so many others, but I pulled up this study because I found it interesting. So people from McKinsey Institute of Health in the US, they did a survey, self-report survey across 26 countries in the world, including Nigeria, 42,000 people, and they were assessing different generations, Generation Z, Millennials, Generation X, Baby Boomers, and they wanted to see what's their self-rated assessment of their mental health in the past couple of years. And it was interesting to find that all the aspects that were x-rayed or studied or surveyed, the mental, social, and spiritual health of the Gen Zs was the worst hit. So they reported, people 12 years to 27 years reported having a decline in their mental health in the past 3 years compared to the older generation. So the millennials, the Generation X, so that's interesting. And this corroborates what we see around us. Young people into substance abuse, into addictions, talking about gambling, talking about pornography, talking about, suicide, terrible things. And the interesting thing, they could only show us the data. They could only, query and question what the reason could be behind this. But they suggested things like maybe these were the generation born with the internet. This Generation Z, ever since they've been alive, they've had the internet. So you know what the internet does? The world has become a global village, but we're lonelier than we've ever been. So that's one of the reasons they propose. And perhaps these people are more aware of their mental health, and so they complain more. These are some reasons why this could be the case. So, what are emotions? So basically, emotions are conscious mental reactions, basically strong feelings, usually directed towards a particular object, a person, or ourselves, and they are accompanied by physiological and behavioral changes. The emphasis for me here is on the behavioral things, the behavioral changes that emotion brings about. These are the things that make us do things that we might regret. Talking about homicide, talking about suicide, addictions. So the thing about emotions is they won't sit on their own. They are begging for action. They affect how we feel physically and emotionally and affect our behavior. So the lady with the dark glasses, I use this picture to explain how emotions affect how we see things, our perspective. So imagine the emotion being like, the dark glasses, and imagine if the emotion is something like fear or intense sadness. So it has a way of giving us a tunnel vision, a one-way vision, where we are only seeing negatives. We don't see anything positive about ourselves, about our world, about other people. So that's where the problem is. And realistic or not, they push behavior. So a lot of times these emotions, and that's where therapy comes in, these emotions arise from thoughts that are not realistic, but the person thinking and feeling them takes them as if they are facts and unchangeable, and they act on them. So where do emotions come from? Actually, they come from the brain. But we know from experience, if you've ever experienced any kind of intense emotion, it feels like it's coming from your heart. A lot of people feel, heaviness. A lot of people feel some pressure. Even physically, cardiologists will tell us that emotions, strong emotions, can aggravate things like acute coronary syndrome. They can trigger things like asthmatic attacks. So we need to look at them in this way so that we don't just see them as, oh, handle your feelings, get over it. These things can manifest physically. If you've ever been heartbroken, you know how it feels to have a lump in your throat. And if you do any test, you will not see anything in your throat, but you feel that way. If you've ever lost someone you care deeply for, there's a heaviness that comes on your chest. So this is somatization. So these emotions, the body can translate them into physical feelings. And in addition to that, they affect our behavior. Okay. Cognitively speaking, from the CBT perspective, emotions arise from thoughts, what we think. So if I come in here thinking, oh, this is a crowd of people eager to hear me and, to listen to me, I might be excited, I might feel motivated. But if I come in here thinking, oh no, they're going to think I'm boring, they won't be interested in what I'm saying, I might come in here feeling a bit deflated. So what I think affects how I feel, regardless of the fact. So you may be bored, and I think you are not, I'll be motivated. You may, so it doesn't matter whether it's a fact or not. And this is the realm of cognitive behavioral therapy, looking at the thoughts that bring about these emotions. And as you can see from this triangle, the emotion does not just arise from the thoughts, it gives rise to thoughts as well. This is what worsens suffering. So if you go from, you fail the test, and you're thinking, oh, this is so sad, I failed, oh my goodness, this is bad, what kind of a person am I? And then you have thoughts about the feelings, oh, I will feel this way forever. You know, you have added a different layer to your suffering. And then you feel, in addition to that, you say, oh, I'll feel this way forever. I would not be able to satisfy my husband because I'm such a failure. My children will not have a good mother. So you see, you keep adding layers of suffering depending on, you know, the thoughts you have about the emotions. So we'll get to that. And then if you can see the arrow between the feelings and the emotions, they guide, they produce behaviors. And the behaviors themselves produce other thoughts. So it becomes a vicious circle. What are the types of emotions? Two basic types. They can be primary or they can be secondary. A primary emotion is the first thing you feel in response to something that elicits the emotion. It's the immediate, instinctual, initial response to a situation. Example of primary emotions: sadness, joy, fear, vulnerability. Secondary emotions are emotions about emotions. So I'm walking us through this so that when we get to where we're talking about how to handle them, you realize that we're not just handling a primary emotion. We have secondary emotions in there, we have thoughts about emotions, so we have to kind of unbundle all this before you are able to get better. So, secondary emotions are emotions about emotion. So, you were dumped, and you're sad, and then you think, how dare he? And then you are angry. And then you are like, oh, and then you think, oh, I'll never find anyone again. And then you're lonely. So different layers. And then they can all get jumbled up with other things. So habitual or learned responses that cover up the sensitive emotions. So anger, for instance, it can be a primary or a secondary. But from my experience, a lot of times anger is a secondary emotion. When someone is intensely angry, very angry, it's because something, a core belief or rule that they live by has been violated. A deep rule that they live by has been violated. And the person feels vulnerable, the person is sad, and then the anger arises to defend these softer, more vulnerable emotions. And because it's more acceptable. So people, the more angry you are, the more you've had your rules violated and you've had softer emotions that you don't feel comfortable expressing. So secondary emotions are emotions about emotions, and they are influenced by personal experiences, beliefs, and thoughts, geared towards self-protection. The reason why it's good to differentiate between a primary and a secondary emotion is because the secondary emotions are usually the ones that show up. And if you don't realize that beneath them, like beneath this iceberg, you can see that it looks small on the top, but if you go deeper, it's bigger beneath than it is on top. The primary emotions are underneath, but the secondary emotions rise up to protect the person, to protect their ego, to protect themselves, and cover up the primary emotions. So are emotions useful? This is an interesting question, because a lot of us handle difficult emotions by just avoiding them. I don't want to feel this way. You throw it away. You don't think about the thing that is responsible for the negative emotion. You want to move on with your life. After all, I had someone tell me, after all, they don't serve any use. It makes me feel weak, it makes me feel vulnerable. People will look down on me, people will take advantage of me if I display emotion. They have no use, let me just move on. So that's the reason for the slide. They are actually useful. For instance, in battle, your emotions are the ones that help you to quickly attack or defend yourself when you don't have time to think and analyze. Disgust, for instance, after tasting food that is bad, will help you spit it out before you even think about it. Emotions give meaning to events, give meaning to our relationships. Without emotions, relationships will be like a contract. You do this for me, I do this for you. So emotions deepen and make our experiences wholesome and meaningful. They also help prepare our bodies for action. For instance, we all know the fear you might feel when you're faced with a difficult exam you need to pass. So that fear galvanizes you to action. It helps you to read and plan and prepare so that it doesn't come to pass. So emotions do have some use. And then, if you're looking at it from the physiological aspect, emotions simultaneously activate certain systems and deactivate others to prevent chaos in competing systems and allow us to give coordinated responses to environmental stimuli. For instance, if you're scared and you're running away from a sudden source of danger, the fear you feel, the surge of the hormones, the adrenaline will make you move before you begin to assess, is that really a lion? Was that really a fire? So you save yourself before you begin to sit down and analyze things. So this is more on emotions being useful. They do influence our thoughts and perceptions, like love. Sometime, I think last year, we talked about emotional wellness, and we talked about relationships. And we saw how the early stages of a lot of relationship, there is this positive outcome expectancy. There is where you see everything good, you expect nothing bad from the loved one, until you get into the nitty-gritty of marriage and you encounter some situations, and then you realize that this perfect person, this handsome or beautiful lady, has some not so nice aspects of her. So emotions actually, they can cloud our vision, like the glasses I talked about. So they can affect our relationships, positively or negatively, motivate our behavior, like anger. Some people actually use anger as a coping mechanism. Some people have realized that they can use anger to control others. So this is what we do with anger management, for instance. People who cannot seem to get a grip on their anger. It is because there's a benefit. There's a subconscious benefit. When you're angry, people shirk, they back off, they give you your way, you have your way. So people notice this and they keep doing this. But of course we know that when you're angry, you may not reason rationally, and then people withdraw from you. So negative downside to it, especially in relationships. But I just wanted us to have like a peek into the reasons why people are angry or display those emotions subconsciously. Then emotions tell us what matters to us. And I'm talking about this in detail because when we talk about handling emotion, you will understand what I'm talking about. So sometimes in therapy, when I hear people say, I want to get over him or her, it's been 2 years and I'm still stuck. And what's wrong with me? Why can't I just move on? And I say, it's because relationships are important to you. Closeness is important to you, and also reflects the depth of your connection. So it tells you the kind of person you are. So if this breakup, you've not been able to get over it for 2 years, it tells you that you care about relationships. Supposing we build other important relationships in your life. So rather than run away from it, relationships can teach us about ourselves. We can also learn something about emotions. It can give us a peek into other people as well. So I've been talking about whether emotions are useful or not, and I said they're useful, and then we'll talk about this more when we get to how to handle them. So that rather than avoiding emotions, we can accept, validate, and act based on our values, rather than act in the direction the emotion is moving us to act. So now we're talking about anatomy of emotions. I mentioned earlier that there are different layers. So it's just like an onion when you're peeling it, different layers. So the first you see this is in layers as how it happens, but how you see it, how you experience it is the other way around, where the secondary emotion usually shows first before the primary emotion, and then the thoughts about the primary and secondary emotions. And then at the bottom of it all is the urge to do something. So that urge to behave in a certain way is why this presentation is very important. And interestingly, the avoidance of emotions or the acting in accordance with emotions is at the bottom of a lot of mental health challenges that we see. For instance, addiction. It would amaze you to realize that the underlying reason why a lot of people get hooked on what they're hooked on is the avoidance of certain emotions. Some people feel like they don't measure up, they're not good enough, they can't stand it, it's not a good thing to think, it's painful to see yourself that way, so you smoke or you drink to drown it off. Some people cannot stand boredom, interestingly. Some people feel like, if I am not actively engaged, then I am unproductive. And if I'm unproductive, I'm not effective, I'm useless, I'm worthless. So they want to do something at every moment. And this is the underlying thoughts or emotions that push people into addictions, or like gambling, like pornography and masturbation, especially among the young people. And then things like anxiety. I don't want to be anxious. It's terrible. People will think I am not good enough. People will see that I'm anxious. My hand will tremble. So because of that, people do other things. They withdraw. They don't want to talk. And then social anxiety disorder is born like that. The intolerance of uncertainty is at the bottom of generalized anxiety disorder, for instance. I can't tolerate the feeling of not being sure. So I want to control everything. And then I'm calling you, where are you? What are you doing? Because I can't take being uncertain. So I just want to, bring out this point that if we don't learn how to handle our emotions properly, it will be the beginning of other mental health problems. So this is an example of these layers of emotions. So example of someone, losing a satisfying relationship or a breakup. So primary emotion, sadness, heartbreak, right? And then anger is a secondary emotion. How dare he do this to me? I should be over this by now. He has moved on with his life. And then we have feeling of being overwhelmed. I'll feel this way forever. Thoughts about primary and secondary emotion. These things worsen the emotion themselves, and they increase in intensity, and they increase the urge to do something. And this is where social withdrawal comes in. This is where rumination comes in, irritability comes in, and we all know the end, suicide or homicide. So, unhelpful ways we handle intense emotions. The bolding of the letters or the font and then the colors is because I want to draw attention to these ways. These are very common ways people handle negative emotions. First is avoidance and suppression. I just lost my sister. Yeah, it's fine. I don't want to talk about it. I'm good. I'm okay. You don't need to, don't check. I'm fine, really. So the problem with this is that when you avoid, you prevent yourself from processing. And when you don't process these emotions, you increase the chances of having what we call complicated grief and increase the risk of having problems later on. So avoidance is at the bottom of a lot of anxiety disorders. Post-traumatic stress disorder, all anxiety disorders actually, avoidance. This refusal to deal with the problem because it's too painful. So a lot of people feel like if I experience this emotion, I had a patient in my clinic and she was really upset and really agitated, and I did what I usually would do. I told her, close your eyes, take a deep breath. She couldn't close her eyes. I was like, okay, can you try for a few seconds? I timed her 5 seconds and she couldn't close her eyes. So she had severe PTSD. She was afraid. I had to be on guard in case, even in the therapy room, people usually feel safe. She didn't feel safe because she didn't know how she would react if she would let herself, feel the full weight of how she felt. Some people feel they'll lose their minds. Some people feel they'll go out of control. They'll go crazy. Some people, I had a patient describe it, I will be unraveled and I won't be able to put myself together again. But the good news, as we shall soon see, is that these are all unrealistic thoughts. I said that people believe the thoughts behind these emotions as if they were facts. But when you check it out, you find out that there are errors in thinking. We'll talk about that later. So the major way people handle emotions that are really unhelpful is to avoid or to suppress. Suppress means replace it with something positive. Don't think about that. Think about good stuff. It doesn't help. Because the emotion suppressed or avoided will affect your behavior, will affect you physically. I talked earlier about emotions showing up in physical, symptoms. Someone can feel, I feel tightness in my chest. It's not asthma or it's the acute coronary syndrome. It's anxiety. I feel like my head is going to explode. There's no need doing a CT scan or MRI. It's somatization. You need to find out what they're trying to avoid. Then another thing people do to try to handle intense emotions is to numb the pain. Go to drink, use substances, engage in sex, recreational drugs, because they can't stand how they feel. Then we all know that emotions can actually aggravate medical conditions. I mentioned that earlier. Then people eat as well, also to avoid intense emotions. The feeling that I'm not good enough, I don't measure up, but when I eat, I feel good, so I eat. And then people have eating disorders, and then they gain weight, and then we look at diabetes and hypertension, and you can take it from there. People engage in unhelpful relationships. The reason why some people engage in infidelity is to run away from the intense emotions they have. Worry and rumination. So rumination is you trying to figure it out. So this terrible thing has happened. This person is gone. This thing you feared has happened, and you just have to figure it out. So ruminating is you keep playing it over and over in your mind. You need to figure this out, figure this out. The thing about rumination, it's one of the behavioral things that lead, it's like on your way to depression. Because when you're ruminating, you are not engaging in life. You are withdrawing from yourself, from your own life, and from other people, because you're trying to figure out this thing. You're trying to figure out, if I had done this, maybe that would have happened. If I didn't say this, maybe he wouldn't have done this. Maybe this relationship will still be on. And then you keep living this life and trying to solve problems in your head, and then your life is moving on. And then if you're a family person, your children are being neglected, your relationship is being neglected, your job is being neglected, and you compound the issue without intending to do so. So worry, usually we use worry to describe when you're thinking about things in the future that haven't happened yet. What if I fail that exam? What if he doesn't like me? What if I do badly? Then rumination, usually to describe something that's happened. So people worry and ruminate to try and solve problems. The problem with worry is that you can't solve a problem before it happens. But we try to do that anyway. We try to control other people. I want him to like me, so I do my makeup, I wear this, I wear that. The truth is, no matter what you do, the person who doesn't like you will not like you. But we try to control things anyway, trying to control what we cannot control. And then we get angry, and then we feel like we are not good enough, and then we feel like we failed, and that compounds the suffering. So distraction is another thing we use to handle intense emotions. People are on their phones, they call it doom scrolling. You're just scrolling, you're not really reading anything, you're just scrolling along. You're trying to distract yourself from something you don't want to handle. Social withdrawal, and then invalidation. I'll talk a bit more about this later. Invalidation means when we say to ourselves, it doesn't make sense. I shouldn't be thinking like this. I shouldn't feel this way. I shouldn't still be hurting after so long. I should have gotten over this by now. I shouldn't have all these complex emotions. This is why I spent the time earlier in this presentation to explain the nature of emotions, just so we know that it's human to have emotions. There's no human being on earth that was born without emotions. God made it that way to spice up our lives, to teach us something, like all the things we've talked about. So if you feel like emotions are not useful, then maybe you should, talk to God when you see Him. But why do we do these things? Why do we handle, strong, intense emotions the way we handle them? Usually it's because of our ideas and our beliefs about these intense emotional responses. And on the other side, on the right-hand side, I've listed some of the common reasons why we do this. If I allow myself to experience it, I'll lose control. I shouldn't have these emotions. In other words, it's wrong of me to have these emotions. It means I'm bad. It means I'm an evil person. Having emotions means I'm not good enough. They don't even make sense. They will overwhelm me. I will not stop crying if I start. So finally, we've gotten to the crux of the presentation. So what do we do? I've been talking about what emotions are, I've talked about the layers, I've talked about the wrong way to handle it. So how actually should we handle this? So if you notice, these strategies are first listed. They are behavioral strategies. And the reason is that when emotions rise and they're intense and they're painful, cognitive strategies are useless. Out the window. You are not thinking right. You can't get yourself together. You're out of control. So we need to do something that will not require you to think. So temperature is a go-to strategy. So for medical people, this is a hospital. So you have a patient who is agitated, who is really upset, and Dr. Anireto is not on ground, and there's no psychiatrist. What you can do, get a bowl of water and tell the patient, take a deep breath, put their face in the water. So doing this will activate the dive reflex. It's actually a physiological response. So what happens is that it will reduce the respiratory rate, it will reduce the heart rate and automatically calm the person down. If it is yourself, put your face in hot water. I'm sorry, cold water. Apologies, please. My apologies. In cold water. So it has to be cold. Thank you. So the reason is that you are not thinking, you don't have to think, you don't have to begin to remember any strategy, you can just act. And later we'll find out that some of the telltale signs that this emotion is intense and painful is you don't want you don't even want to be consoled. You don't want to listen. You are only moved by the urge to act on the emotion. So these are telltale signs that you know that you've gotten to the stage where you should probably do some of this. When you don't want to listen, you can't control yourself, you just want to act out that emotion. You are being solely moved by the emotion. That's, you need to do something. You should either put your face in cold water or engage in intense exercise. So you see people jogging. Doing that will dissipate nervous energy and reduce that push, that urge, that push of the emotion to act and do something. So talking about maybe conflict in the house, you're very angry with your spouse and you just want to cut off her head or do something. You have gotten to that stage, leave the house and take a walk, jog. Paced breathing is also helpful. This is 4-7-8 breathing. I've taught this before, but let me just go through it again for those of you who are not familiar with that. So the 4 is take a deep breath for a count of 4. The 7 is hold your breath while counting to 7 in your mind. And then the 8 is exhale while counting to 8 in your mind. So take a deep breath while counting to 4. You hold it for a count of 7 in your mind, and then you exhale for a count of 8. So this actually, it helps to kick in the relaxation response. Sometimes I do it for patients who are not even in therapy. White coat hypertension, they come in, blood pressure is high, they're nervous. I'll say, take a deep breath, count to 4, hold it, count to 7, exhale, and then they calm down and the blood pressure goes down. So this is a response that will stimulate your vagus nerve, will reduce your heart rate, reduce your respiratory rate, and calm you down automatically. Progressive muscle relaxation is where you gradually contract muscles starting from your face, your fists, your arms, your forearms, your chest. You contract each of these muscles in order. Contract them, that is, contract your muscles as tight as you can and then relax them. So doing this gradually will relax you. Other ways to handle intense, painful emotions. Be mindful. What that means is recognize when there's something called emotional mind and wise mind. This is according to Dr. Marsha Linehan, and she's a psychologist and a founder of dialectical behavioral therapy. So she realized she handled a population of teenagers, young people who were suicidal. And she initially tried using the cognitive approach, your thoughts, and that made them feel like she wasn't understanding what they were talking about. Then she tried to use the acceptance approach, where she said, oh, it's okay to feel this way. They're like, it's okay to feel this way, how are you going to help me? So she discovered and she developed something called dialectical behavioral therapy, which is where you accept, validate how you feel, but not necessarily act on it, act in opposition. So she developed something called emotional mind and wise mind. So earlier when I was talking about how to handle emotions, when I said temperature and exercise and the rest of them, being able to tell when you are functioning in the emotional mind and when you are functioning in the wise mind is enough to help you to handle how you feel. If you can recognize that I am at the stage where I really don't want to listen to anybody, I am really, really upset right now, I want to just go with the flow of how I feel, then you are in the emotional mind, and chances are you'll probably do what you regret. So being able to just identify it without acting, don't do anything, is helpful to handle the intensity of your emotions. Then being in the wise mind, if you can realize that I'm not in the wise mind, in other words, I am not thinking about the long-term consequences of my actions, then you know that where I am right now, I should do nothing, don't act. So being able to recognize when you are in the emotional mind or the wise mind will help us to handle intense, painful emotions. Express. So a lot of times with women, it's a lot easier. We can talk about it, we can cry about it, we can scream about it, express. So there's nothing wrong with expressing how you feel. Some men feel like if I say how I really feel to my wife, she's going to think I'm weak. She's not going to respect me. I've had so many people say this to me over and over again. So one of these times I said, you know what, is there a way we can test this assumption of yours? Can we see whether she'll think you're weak? Can we start with something that is not so deep? Talk to this woman. Let's see whether she will think you're weak, or she will think or disrespect you. So they did. And to their, greatest surprise, the opposite was the case. It deepened the emotional bond between the man and his wife, and it made them to connect more, and there was no such thing as disrespect. Rather, it was the other way around. The woman respected him enough, because even more, because he told her the truth about what was really going on. This is talking about a patient of mine who was gambling, addicted to gambling, and he felt like, if I tell my wife what I'm going through, she will realize how weak I am and not respect me. So expression, not only for women, but for men as well. When you talk about it, even if the person listening cannot solve it, and they shouldn't even try to solve it, because when someone is expressing how they feel, they just want you to listen and validate. We'll talk about validation in a moment. Listen and validate, because your attempt to try and solve what they're saying, it makes people feel invalidated, like you're not really listening, and it makes them feel like you're patronizing them and you're trying to reduce the intensity of what they're telling you. It's just listen. So how to handle intense painful emotions? Express it. Some people who don't have confidence, I don't have anyone to talk to. I've had someone say, you are literally the only one I tell things to. And I say, you know what, you can journal, you can write it down. Write it down. There's something about putting your thoughts on paper that creates distance between, what's going on inside and how you feel. And just seeing it stimulates creativity, and all of a sudden you become your own problem solver. You don't even need, you're like, oh, really? This is it? But when it's in your mind and you're mulling it over and over and ruminating, it takes on a bigger stance, or looks bigger, it's magnified. Another way to handle intense painful emotions is to act in opposition. If you can identify that you are in that state of mind where you are acting based on your emotions, and you don't want to listen, and you just want to go through with how you feel, then rather than going through with how you feel, do the thing that is opposite to it. Do the act in opposition. So for instance, if you feel like you want to withdraw, you just want to be by yourself, you need to sort things out. I don't want people to, I don't want to talk to anyone, I just want to be by myself. Do the opposite, engage. And then test how you felt. Compare how you felt when you were by yourself and how you felt when you engaged. A lot of times people will realize, oh, I actually did feel better when I engaged. You don't need to tell whoever you're engaging with what's going on. Just do something, go out, go for a walk, talk to someone about something completely unrelated. The intensity of the emotion will come down. In green, I've written, check the facts. Remember how when I was talking about emotions and their ability to drive behavior, I said the thoughts behind the emotion don't even have to be facts. A lot of times they are completely negatively skewed. One common example is, this is my fault. This is all my fault. So I hear this a lot in failed relationships. The marriage collapsed because of, it's my fault. I had a patient recently who lost a loved one. And the loved one, before she passed, was quite a traumatic loss, because she was on a call with the person and they finished talking, and then somebody called her shortly after and said, that person you just spoke to has slumped and is dead. And she thought it was fraudsters. She called the person's child and they said, oh, I haven't heard from her. And the next thing she heard was the doctor called her with the same line, because they called the last person that the person had spoken to, and said, who are you? You spoke to this person has been brought to the hospital and is dead on arrival. So in her mind, because before this happened, this person who is a beloved, dearly loved sibling wanted to borrow money from her. So she didn't have money actually, so she didn't give. And the person wanted to go out for a medical check. So when this happened, she said, I killed her. This is my fault. This is all my fault. And we had to look at the facts. I don't know if it's your fault or not. Let's check it out. Let's look. Could this be a cognitive error? So we realize that a lot of us do this, especially with this, it's all my fault. We blame ourselves for decisions that we took when we didn't have the full information. So she didn't have the money. It's not like she had the money and didn't want to give. She just felt like if she had known, she would have done more to get that money. But this information only came about after the lady died. Then she realized that she had some physical problems that she had never divulged to her. So she was judging herself based on a decision, I can't give you, that she took with information that she didn't have at the time. So we do that a lot. We judge ourselves and blame ourselves for making decisions that at the time of blaming ourselves, we see that, you know, we shouldn't have done this, but we didn't have the full information that we do now. I hope I'm communicating. So this is why a lot of times when someone says, this is all my fault, I caused this, I'm a bad person, and then it brings up all the core beliefs. And I've been working with this person in therapy. She's been through so much. She has PTSD, severe depression, bipolar, a lot of difficulties. So I told myself, I will not let you in my mind. I will not let her leave this place thinking she's to blame, because I may not see her next time. So check the facts. Ask yourself, what is the evidence in favor really that this is my fault? If we were to use that thought as an example, what is the evidence in favor that it's my fault? What are all the evidences? Is there perhaps any evidence to the contrary that it might not be my fault? Is there an alternative way to look at this? Is it possible that I am overgeneralizing, or I'm magnifying, or it is catastrophizing? So check the facts. Is what that means is ask of the identify the thinking error that you might have, and ask these questions that I've been listing out for you. What is the evidence in favor and against? Is there an alternative way to look at this? Could this be an example of some kind of error in thinking? Could it be me catastrophizing or overgeneralizing, for instance? That's another common error we make. So he didn't call me on my birthday. He doesn't love me. And then you ask yourself, what is the evidence in favor of this? Hey, he didn't call me. Who does that? Who doesn't call his wife on his birthday? Who really does that? That is evidence. And he doesn't like. So what is the evidence against? You know, it's funny, but this is really what goes on in people's mind. It's funny because we're saying it like this, but when you think about it, people really feel these things. What is the evidence against, for instance? And okay, well, I don't lack for money. You know, he takes care of us. He provides for me. He listens to me. And then when you say all this, and then you have a long list of evidence against, and then the person starts laughing like, okay, I get it. It's not true. The point is that until we learn to evaluate our thoughts, evaluate means question them. Ask yourself, is this really a fact or is an idea? If you allow yourself to act based on how you feel or how you think, you may make a mistake based on an idea that is not even fact. I'm going to list out unrealistic beliefs about emotions. These are things that if we respond to them, will also help us to handle intense, painful emotions. I mean, beliefs about the emotions themselves. Remember when I talked about emotions, I said there are different layers. You have the primary, the secondary, then you have the beliefs about the emotions themselves. So some beliefs about emotions intensify suffering. So if you're able to respond rationally to the beliefs about the emotions, you will, make your suffering much less intense. So I'm going to read out the negative self-talk, the beliefs about the emotions. My emotions don't make sense. I must be the only one who thinks like this. Other people don't think like this. Other people have a clear mind with pure emotions. But me, I am angry. I am sad. I am afraid. I am frustrated. How can one person feel? And the response is, emotions tell us something about ourselves. And to have that range of emotions is normal, because emotions, they typically gather themselves in layers. They are not one. My emotions will last forever, and this is a very key one, because this is, when somebody wants to end their lives, they feel like this thing they're going through will never end, and they believe it as though it's a fact, and their thinking is that I can't live like this. I cannot keep suffering like this. It's better I escape. It's better I leave this world. So if you understand the way they're thinking, you will understand their behavior. that this leaving this world is their way of coping. I can't keep suffering like this. And they really believe that the way they feel will last forever. But when you respond and you tell them that actually all emotions, unfortunately even positive ones, they're like waves. They rise and then they fall. And this is where therapy comes in. We take advantage of the fact that emotions that push people to intense, drastic behaviors, they are like waves, they rise and fall. So we know that while they are feeling this way, we need to do something and tell them that it will not always be like this, even though they feel that way, before they act, when they're at the peak of their emotions. So emotions go up and they come down. So a typical question is, can you remember a time in the past, maybe 5 years, when you were intensely upset and unhappy? And they're like, yeah, a lot of people can remember that time. And I say, fast forward now, how do you feel about that? They're like, I've processed that, that's in the past. And I said, what does that teach you about emotions? They're like, maybe it doesn't last forever. But the thing is, in the moment, they feel these things to be true. And unfortunately, they give in to the urge that, I said behavior is part of the layer of emotions. They give in to the urge and act on it, not realizing that it's not true that it will last that way. It will be that way forever. Another negative self-talk is I need to control it, otherwise it will overwhelm me. So this need to control the way we feel actually compounds things. So emotions, they rise and fall. You don't need to try and control them. When you try to control them, you will actually make it worse. Anything you focus your mind on, be it trying to control it or whatever, gets magnified, gets bigger. So in your attempt to, prevent yourself from feeling anxious or remove this fear or intolerance of uncertainty you have, and you keep trying to control things, what will happen is you make things worse. So an example is, I feel like I'm vulnerable, and I feel like maybe my husband, my spouse might cheat on me. He has gone out, there's no telling where he is. I can't, he has cheated in the past, maybe, or maybe not. I suspect. It has not been proven. And then I try and control things by calling and calling and calling. Where are you? What are you doing? Some people, let me see your phone. Some people show up unannounced, trying to control things because they can't stand how they feel, trying to control that uncertainty. So what happens is that you will make yourself a nuisance, push the man away, increase the likelihood that he will actually cheat because you are not fun to be around. So you have actually, turned that idea into a self-fulfilling prophecy. So leave the emotion alone. You can actually distance yourself from it. So I tell people, pretend that the emotion, that your mind has different compartments. Can you put the emotion in one compartment and act based on what is important to you? Can you just step away from it for a minute? What is important to you? And they say, my kids, my job, God, my health. Okay, can we have you, do something in line with your values? What would you do that would be you acting in line with the fact that you care for your kids? I could spend more time with them. So we've left the uncertainty, is he cheating, is he not cheating? We've left it somewhere. We are now engaging in things that are important to this person. So what happens is that anxiety drops and the person becomes a better person to hang out with. And the telltale, risk of this man doing whatever is reduced because, of course, we can never predict people's behavior. But the person is generally a better person to be with than when you are trying to do something to control this emotion. So don't control it. Let it be. It will increase, it will reduce. So another way we use this is in trying to help people that have phobias. I'm afraid of heights. So I try to avoid things that make me afraid of heights. Remember I said one of the unhelpful ways to deal with these emotions is avoidance. So I stay away from anything. I don't enter elevator, I can't go upstairs, I can't go into a plane. And what that does is it strengthens my idea that, oh, thank God I didn't go there. If I had gone there, it would have been terrible. So I maintain the fear by avoiding it. So instead of trying to control the emotion, we will rather open the door and, experience it. So we do that in, different levels. We create a hierarchy of things feared, and then we start from the one that is least scary, and then we begin to ascend the hierarchy. So let's say it's an elevator. We can stand in front of an elevator, open and close and go away, and we're done. The next time we can come, we can enter the elevator, we can open it and come out again before it goes up. And then, but you need to stay in that, feared environment for some time. And then people realize that even though initially the emotion would rise, if you stay there long enough, it will come down. And next time you expose yourself to the feared thing, it will not rise as high as it rose initially. And if you keep doing this, the graph begins to reduce, and before you know it, it's boring. And you tell me, are we going to be going up and down the elevator all day, therapist? And then we know that we have arrived. And the thing is no longer scary. And you're like, oh, this is boring, it's no big deal. So don't try to exert control. Then negative self-talk about emotions is that emotion shows that I'm weak and I'm feminine, I'll be disrespected. And then the rational response is it makes you human. Another way to handle intense, painful emotion is to label it. Call the names of it, all the range of emotions you experience. So this creates distance. So you realize that I'm sad, I'm angry. It doesn't make me an angry person or someone who has an anger problem. I'm just angry. I am sad right now. I'm not depressed. I'm just sad right now. So it creates distance between you, the character of the person, the personality traits of the person, and the emotion. Then validate yourself. Now this is in red because it's very important. Validating just means accept it and say it's okay. It makes sense to feel this way. It's not wrong. It doesn't. It's not that it doesn't make sense. It actually makes sense given so and so. It is invalidating ourselves that intensifies our suffering when we feel like I shouldn't even be feeling this way. I am supposed to have gotten over this by now. Other people in my situation have gotten over this. So and so has moved on. I must be a failure for not being able to move on. And then you compound things. So yeah, I've not gotten over it. I had a very strong connection with the person. That's how it is. I'm not getting over it doesn't mean I can't go on with my life. Accept. So instead of avoiding, suppressing, accepting these emotions without judgment or self-blame, you don't have to act on the emotion. You can actually act based on what is important to you. Reduces their intensity. And the reason it does is that you are not fighting with yourself. Some people are fighting with themselves. The emotion is on its own. The thing that has happened. The primary or secondary emotion is there. But then there comes all these, nuances and undertones of, but I shouldn't be feeling this way. This doesn't make sense. It makes me feel this. It means this about me. It means I'm worthless. It means I'm not good enough. And all these things magnify the suffering and intensify the pain. So distancing. I gave you an example of containment. Don't control it. Just put it in the corner of your head. Pretend your brain has shelves. Put it on the shelf and do what is in alignment with your values. So I devoted this slide to explain this because a lot of us don't really know how to validate other people. When I said if someone expresses their emotions, you don't have to solve, you have to listen and validate. There's something called toxic positivity or positive invalidation. So you think you're helping, but you're actually making things worse. Things like, oh, don't worry, it'll be okay. Look on the bright side. Cheer up. That's the worst. Cheer up. It's okay. It's not the end of the world. So the person feels like you don't understand. So how to invalidate is encourage expression, reflect the pain and suffering the person is going through, and let the person know that it's okay to feel this way. It's okay to feel this way given all you've been through. Anyone in your shoes would feel this way. You're human, that's why you hurt so much. So validate means to say that it makes sense. You are human, it's okay. That's basically what validation means. So I'm going to start rounding up. I've been given a cue that my time is up. Other ways to handle intense painful emotion is to have a routine. So when I said rumination is negative, is not helpful. For people who are, if that's your go-to way to handle negative emotion, I'm not suggesting you don't do it at all. I'm suggesting you limit it to, discrete, short intervals, short times. Ruminate, but then have a routine that you go into. That doesn't necessarily mean that you're thinking, you're just doing stuff. Behavior, remember that our triangle. Behavior can affect emotion. In fact, behavioral therapy, it's cognitive behavioral therapy. So apart from your thoughts, what you do can actually affect your emotions. So sometimes if you are too intensely hurt to think, do something, it would help. Then learn from what has happened about your values, about your needs. Problem solve. There's actually a whole list of how to go about problem solving. Identify the problem, list all the options, advantages and disadvantages of each option, choose the option that has the highest advantage and the least disadvantage, try it out, implement, go back to the list. So there are actually steps that you can use to fix and solve any problem. Behavioral activation, do something that gives you a sense of mastery or pleasure. Social support is invaluable. And remember, you can support without necessarily saying anything. Listen and validate the person. Spirituality is invaluable. A lot of times, except in few cases, what has stood in the way of my patients and suicide is God. So I play, I whip up that when there's nothing else to do. But sometimes, I recently had a patient who, I did the spirituality and it worked. Then she came back and said, I don't believe God will send to hell somebody who's trying to escape such pain like me. And then we had to use another approach. But I'm just saying that a lot of times what keeps people alive is their belief in God. Then visualize yourself accomplishing your goals. When we looked at that slide where it had the woman with the shades. So if you visualize your dreams, it motivates, it creates a reason to live, your accomplishments, what you could do, what you could bring to the world, what your kids could bring to the world, what would happen if you were not there, talking about someone who's intensely suicidal. Then I found this to be very helpful for people who struggle with worry. Worry is incapacitating, it can paralyze. If you would realize that there are two types of worry, that the ones that are productive and the ones that are unproductive. An unproductive worry, for instance, is worrying about people's opinions, worrying about what people think about you, worrying about what other people will do or say. You cannot control anybody. So if you find yourself engaging in that kind of unproductive worry, there's nothing you can do about it anyway. So identify it's unproductive and use your energies to do, to solve the one that is productive. So I found this to be helpful, that if you are able to say, oh, this is an unproductive worry, just labeling it as that helps people to, reduce the intensity of their emotions. Then forgiveness is something else that is very key. A lot of times people are weighed down and dragging themselves around because they can't let go of what they think they've done to themselves or what they feel somebody has done to them. There's something called loving kindness meditation, especially in couples that have separated or in the process of separating or divorce. There's a lot of animosity, a lot of hostility, a lot of anger, a lot of, unforgiveness going on. So what this basically means is I have them close their eyes, they're lying on the couch, then I have them imagine someone they love, and imagine, and they call a name, so we want to paint a picture, describe what is he wearing or she wearing, what is he, what's the expression of their face like, someone who they really care about, a child, a friend, whatever, and then imagine this person wishing you well, wanting you to achieve everything in life, sending you prayers, sending you best wishes, and you imagine yourself receiving all that. And then when we are done doing that, by the time they're done doing that, they're smiling, their eyes are closed. And then I said, replace this person you love with this particular person that you're struggling to forgive. So replace the person you love with that person. And then, having received all this love and kindness, can you see yourself giving this love and kindness back to this person, irrespective of who they are? You're just so full of love and kindness that you have them to give. And if you are able to get the patient to vividly imagine the person that they're angry or upset with in that moment and doing this, it usually brings out a lot of emotion. So you have a lot of tears, you have a lot of, You know, people clutching their wrists, people crying, and people saying, I can't do this, and I'm like, yes, you can. But when they say it, and I say it, and they keep saying this and practicing this, with that imagery in mind, sometimes there's a picture, this actually helps to, you know, people who have difficulty forgiving, it helps them to forgive. And once they are able to forgive, it's easier going forward. A lot of emotions goes with, you know, once you forgive, once your forgiveness goes, the intensity of the emotion reduces. I'm rounding up. Then the question is, how do you reduce your vulnerability to negative emotions? How can you proof, you know, like negative emotion proof yourself? Especially if you find out that you've been in and out of difficult situations, having intense, painful emotions, and you're like, you know what can I do to, you know, to desensitize, inoculate, full emotion, negative emotion proof myself? And then this is where this comes in. Accumulate positive emotions. That means do daily something that you like, that'll give you a sense of pleasure or a sense of mastery. Plan yourself in such a way that you achieve something that is important to you. When you walk towards that thing that you want, that is important to you, it gives you motivation and it helps to, you know, increase the positive emotions you have, because you have aligned your life in achieving, to try and achieve these things that are important to you. For instance, you've always wanted to have a master's in so and so. You've always wanted to study so and so. You've always wanted to, you know, do something, but, you know, you've been busy, you've not actually done it. So accumulating positive emotion would be you thinking of what can I put in place with my life as it is, that would be me bringing to pass this thing that I aspire to have or dream of. So doing that gives a sense of mastery and a sense of pleasure, and it's something you are working on, so it keeps you positive. Build mastery. So whatever it is that gives you a sense of achievement or mastery, go ahead and do it. Cope ahead. This is especially useful if you anticipate. So you say to me, I'm good now. But when he or she comes into the room, you won't believe how I will react. So what we do is we do something called a covert rehearsal. Maybe you've had an experience with the person in the past. So, or you imagine, maybe it's not even, you've never had an experience, you're just imagining this would happen, this would happen. So we list out all that could possibly go wrong, and we'll bring out solutions to them before it happens. And then we, you know, practice, we do role play. I become the person that, you know, you don't like so much, and then you are you, and I'm trying my best to be my most antagonizing and cause friction, and then you are using the skills we just learned to counter me and help yourself, you know, be assertive. So in that way, the person is prepared ahead of time before facing whatever it is that they're going to face, that's going to give them negative emotion. And the rest of them are easy. Treat physical illness. We know that there's a relationship between our physical health and emotional health. So if you're not very strong physically, the tendency for negative emotion is there. The tendency that you're not going to be able to handle things as well as you probably should is there. Eat a balanced diet. If you're not eating very well, maybe you're stressed or something. Actually, Dr. Halima will tell us that not having enough vegetables and fruits is actually a minor risk factor for cardiovascular disease. So these things increase our risk for physical illness, which will reduce our ability to cope and increase the likelihood of negative emotion. Then sleep well, exercise. I need to rush, so I'm going to conclude. So many mental health disorders arise as a result of inordinate fear of emotions. Uncertainty, boredom, frustration, sadness. So people don't know what to do with these emotions. So in their attempt to handle it, they make things worse, and, you know, we have a mental health disorder. And the consequences of acting on our intense emotions can be catastrophic. If you believe the way you're feeling will last forever, then you would want to get an escape route. You want to do something to end it now, which is unhelpful. And learning how to handle these emotions is key to improving our mental health and well-being. Thank you.